Good afternoon, everyone, and welcome to HHD Stories Come to Life, where we profile the journey of our alumni from CSUN student to working professional. My name is Michelle Best, and I am the Interim Dean of the College of Health and Human Development at CSUN. This series is brought to you by our college's Reputational Pillar Committee. This interview is being recorded and will be shareable. Today we have with us Scott Ponaman, a graduate of our Bachelor of Science and Masters in Health Administration program. Mr. Ponaman has spent the majority of his career providing individualized, compassionate care to those populations who are underserved by traditional government programs. Beginning his career as a clinical nurse and then progressing into positions in policy, marketing, and business development, Mr. Ponaman has had the opportunity to make a significant impact on both the public and private sectors. Mr. Ponaman founded the Ponaman Organization in 2001 as a way to share his expertise with nonprofit healthcare organizations and government agencies. In this capacity, and through his extensive knowledge of healthcare and policies, he consistently has created forward-thinking solutions that have resulted in creative, strategic approaches to the problems faced by the industry for more than 20 years. Welcome, Scott. We are so happy to have you join us and share your story.
Thank you very much. It's an honor for me to be here today also.
I'm going to start by asking Scott some questions, and then at the end of our conversation, we will have time for a Q&A with the audience. Please feel free to type your questions into the chat as we go, and then we can go over them later. So let's get started. Scott, first of all, why did you choose to come to CSUN instead of going somewhere else?
Sure. There's lots of great reasons for it. I actually lived in the San Fernando Valley at the time, so the location was as good as you can get. I also worked for Kaiser for many years, and they strongly encouraged me with my nursing background and desire to continue to grow into the operational levels of healthcare to go to CSUN. Many of my peers graduated from CSUN's programs and really gave me a strong boost and passion for wanting to be part of the programs at CSUN. So there's many other factors, but those are probably the most important ones.
And when did you know, or did you always know that you wanted to work in healthcare? And how did you choose your major?
Sure. I actually started very, very young. It's one of those things you find that's in your blood. At a very young age, I started as a volunteer in a hospital. I also volunteered as through the Boy Scouts at the time as a healthcare explorer to gain experience and observational opportunities at hospitals. And all of that really culminated for me through high school. I had the opportunity to go through nursing school along my personal journey and work for Kaiser for 17 years in those types of roles. And then, really it just continued for me. It became a passion for me to continue to learn, find new avenues and journeys. And even today, with the work that I do from a consulting perspective, there's always a new journey that I develop a passion for, and I'm lucky enough to be in a position to go down those routes, take the risks, and at the end of the day, I find great passion for what I'm able to accomplish in my role.
So tell us about what it was like being a student at CSUN and any challenges you may have had to overcome as a student to get you into the career that you're in right now.
Sure. I have to laugh because I think I started at Pierce College and transitioned into the same challenge of finding parking, whether it was the first day or my last day. Was probably my biggest challenge of school. And of course, managing a tight budget at the time. Books were very expensive, and as you got into graduate school, they weren't so much books, there were discussion guides and articles and different pieces that the university gave us to really have an experiential learning opportunity. So in terms of selecting my major, like I said earlier, I was already working for Kaiser. I was in a clinical role. I felt like in my own heart, I had more to give. And I thought through my education, it would give me kind of the pieces in my own mind, my own thinking, to be able to provide more energy, to provide more quality in my commitment to what we can do, and to bring a skill set that's not just based on my years of working in healthcare, but in fact based on policy research and learnings from people at CSUN who worked in the field, which was probably the best part of the program for me, was that the people who were teaching us actually were doing it. I spent a part of a semester at USC in their program, and I came right back to CSUN. And really the reason was, it was the people, it was the faculty. I felt like every day was just another exciting day to look forward to learn something new from somebody who, had a great personality around it, understood it, and could tell you the real world as opposed to what the textbook says. So that's for me, a big part of why I went to CSUN, why I continued with my graduate degree at CSUN, and today always have wonderful memories to share with people.
Maybe you could share one of those memories with us. I don't often get to interview alumni who've done both a bachelor's degree and a master's degree with us. So it would be good to hear about some of those experiences, maybe something you experienced at the undergraduate level, something you experienced at the graduate level.
Sure. And there's a lot. When you're in the undergraduate program, you're really heavily focused on a lot of what I would call distractions. You really want to spend your time in the classes that are in your major with the people who are, for me, I was a little bit older, so the people were younger, but there was a lot of great energy and learning from them, as opposed to all the general education requirements that I know we all have to do, but sometimes it's painful when I much rather be working, listening to one of Dr. Coulter's classes or Dr. Reagan's classes. All were fond memories. So that was part of it for me. Every project we did had meaning to it. It wasn't a matter of doing a semester report on a subject that just happened to do with healthcare. It actually always had something to do that shaped my thinking process, my decision-making process, and what I could bring to the table that brought value and a sense of commitment, and that I was contributing something that had meaning. And I really learned that in the undergraduate program. I really started to build my skill sets in terms of writing, verbal communication, that I carried on into graduate school and continued to develop. So it's hard to say just one specific thing in undergraduate school, but it was more of the theme and the culture of being at CSUN with people who shared similar desires, goals, and objectives, and everybody was going a different direction after undergraduate school. And my direction was to keep walking down the same streets through the yards, the parking lots, to the same buildings to take my classes. And as I moved to graduate school, the experience of just doing that was so huge to me. Every class was a group setting. It wasn't a matter of just going and hearing a lecture, but a lot of fun and excitement. And when we did projects, we ended up rounding together the same group of people to work together. We all knew each other. We knew each other's strengths and weaknesses. And I learned more from that kind of experience and probably anything else in my professional life that really contributes to why I do what I do today.
So maybe you could tell us a bit about, I know you were working before doing the degrees and working during the degrees and so on, but tell us a bit about what your career path has been like and how you got to the point that you're at today.
Sure. It's kind of interesting because my career path really follows both professionally and personally. Like I said earlier, worked for Kaiser from a clinical perspective for many years. At times I was asked to lead certain departments that I worked within, primarily in the emergency area, the urgent care area, and several of the specialty clinics. And as I learned more and realized I could help other people contribute and have positive experiences, I wanted to do more. I wanted to function at a different level. So the word operations kept coming up for me. So that's what actually encouraged me to come back to school after nursing and do the bachelor's degree. And after the bachelor's degree, I actually worked with aerospace companies, helping them to design and manage their healthcare benefits.
Okay.
And which was a lot of experience. Some of it was industrial. They're aerospace companies where I had to use not just my healthcare experience from the undergraduate program, but my nursing background also, and problem solving, crisis management, and those kinds of things. But I also realized the more I did it, I wasn't really going in a direction where I was building something new for myself and something I had passion for. So I came back to school and went to graduate school. I was luckily enough able to transition my role at Kaiser into their regional offices in Pasadena, where I was able to start working in a special program with the Medicare population for people who lived in assisted living facilities. And it had a tie into both that part of it, as well as helping the organization recognize additional revenue from Medicare at the time for patients who required assistance with their activities of daily living. So it got very personal. I was the kind of person who wanted to go out into the field and see people and develop a relationship, because we had to collect information on these patients every month and submit it to CMS. So I got into this role of really seeing my job more as my life and not just as work. And as I grew in that job, I was asked to take responsibility for very large employer groups with Kaiser, which include the federal government, the state of California, the Los Angeles Unified School District, and what they call the book of business that I was responsible for were over 1 million lives who were active members of Kaiser in Southern California. I did very well. I excelled in that role. I developed a lot of great relationships. We implemented quality reporting during that time frame, the HEDIS reporting, and I ended up being promoted into a statewide position to manage those same groups on behalf of Kaiser as the account manager and liaison with the government representatives. And then as I continued on and loved the work, I met my wife. I moved to Arizona, and I was given an opportunity to become a consultant with a international consulting company by the name of William Mercer. And the person who hired me said, you know, you've got a phenomenal understanding of how healthcare works. You understand the payers like Kaiser at the time, commercial insurance, and you've learned all these things. You need to bring it all together where you can provide benefit at a greater level. So I was actually asked to develop and implement a quality management team that would work with state agencies to look at specific programs and to develop new programs for people, for example, with acquired brain injuries, and look at what their needs were, and then to bring the right services to the table to meet their needs and to have waiver programs approved by the federal government to fund these programs. So I got involved with that work. That evolved in working with the HIV programs in Washington, D.C. when Ryan White was a brand new, unheard of program. And then after a couple of years of that, I decided, I love this. I want to do it on my own. That I see what they charge for my time, and I don't get 2/3 of that, but it was more of I wanted to keep doing what I was doing when I wanted to do it with who I wanted to do it with. So I developed my own consulting company, and I worked on my own independently for 2 years. And then all of a sudden I needed help just coordinating my schedule because couldn't be in 2 places at the same time. And this was way before Zoom technology. Basically, I ended up starting the company that's known today as Ponaman Healthcare Consulting. We've been open as a team since 2001, and we continue to work in the safety net programs, developing programs primarily focused on ensuring, regardless of who you are, what you are, what your income status is, your insurance status is, that you have access to affordable drugs, whether they be prescription drugs, chemotherapy, whatever your needs are, that nobody ever walks away from being taken care of. So that's what I do today. I have incredible passion for it. It's what I go to sleep with at night, what I wake up in the morning, and I always have my education, those experiences from both the people I went to school with and the people who taught me, always on my shoulders.
Mhm.
And I really feel like it helps me do what I do well, with respect and honesty and credibility. And that's what I'm known for in the industry. And I was one of the first consultants to work in this part of the industry. And as a result, I keep doing it and love it every day. So I know I can go on about it. Anything I have passion about, I could talk a lot about, but let me stop with that and answer your other questions.
It's really quite a story. And, I like how you talk about reaching back into nursing and
Mhm.
pulling from skills that you developed there into your bachelor's degree and pulling those skills into the master's degree and pulling those skills, and all of those things coming together to help you to work in these different areas.
Right.
It's something we try to emphasize with our students, that where you start isn't necessarily where you will end, but you're learning, you're building that knowledge, you're building capacity, you're building skills in all of these areas that you can, these skills are transferable, knowledge is transferable. And so that's really interesting to me. And I think
Yeah.
what you're doing now is probably something most of our students may never have thought about as
Right.
they're, thinking about becoming a nurse or a health advocate, or maybe even some of them becoming doctors and so on. But that's a very direct patient care skill set that they're
Right.
thinking about, job area that they're thinking about, but not how building the knowledge and the skills in those areas could then be transferred to working with patients in a whole different way that also improves the quality of life that they're able to experience. So thank you so much for sharing that. And I want to talk a little bit more. Yes, you have all of these skills, but you didn't go to business school. You have all of these skills. It's really in this healthcare profession, but you started this one-man shop. It expanded to a point you didn't anticipate, and you needed more people, you needed assistance. So now you really have a business that's not just an individual doing something, but a business that employs people, and you're doing other kinds of things. So if you could talk to us a bit about that side of things, what's it like to be an entrepreneur?
Sure. Sure. It's funny because if I was talking to you a few years ago, my response would be different. We've all, as a society, as people, as employees, as families, have suffered through quite a bit the last couple of years with the pandemic
Mhm.
and other issues. And so for me, I had to become much more creative and independent thinking and responsive to the people's needs who work for me. I've always seen my employees as a family, and they all know that. There's a lot of things I give up personally to make sure they are taken care of as if they were my children or my brothers or sisters. I always get yelled at by my healthcare benefits broker. Why do you provide the highest possible level of benefits at no cost to your employees and their dependents? I said, because these are my family people. I've been through traumatic illnesses, and I don't want them to have to worry about whether they can afford to pay for it. That should be the last thing on their mind. And so I treated the business that way, and the people who I work with and for. And as an entrepreneur, you take risks. You need to survive and to prosper in a business. And I would encourage people not to go away from that, to dive right into it, because no matter what happens, you could fail at something, but what's more important is what you learn from it. I make mistakes all the time, everybody who works for us, and it's not so much about what the mistake was, but what you learned from it. There's a couple key things as I was listening to you speak and myself talking that jumped off the page at me, kind of experiences that I brought into what I do today, from lectures from people, my experiences at CSUN. Several years ago, for example, I had the opportunity to hear a hospital administrator from I think it was Tarzana Medical Center at the time, who came in and spoke to us. And he said, there's a couple of key things I want to tell you. He says, if you want to come to work for me or anybody else in healthcare and truly be a valuable employee or leader, is you have to have the best communication skills in the world. He says, I hate hiring people, whether they're graduates or undergraduates, and they can't write, or they can't speak publicly without feeling like they're shaking. And I took that to heart. It really meant a lot to me to learn, both in my undergraduate experience and more so even in my graduate experience, that people who read what I write, whether it's a report or whether it's a presentation, that they feel like we're having a discussion, not like I'm reading off a page to them. And it should never be that way. It should always be a dialogue. And then that culminated for me when I wrote my thesis, and Dr. Coulter at the time was my advisor and really a friend to me. And one of the things she told me that I take with me everywhere is to always write as if you're talking to people. Well, she read my thesis and I went through pretty quickly and did a ton of work. Was research, survey research oriented. And she helped me section by section review and give me feedback, and got through it, with not too much pain. But the key thing was, I felt like every time I went back to the computer to work on another section, like I was having a dialogue with her about what I was experiencing and learning. And there is so much truth to that, that I want, if people take away one thing from this discussion today, it's write like you're talking to somebody. That's what they want to hear. They want to hear from your heart, your experience, or your observations, or what your thinking is, why you should do what we think you should do, that kind of thing. Just do it, and take the risk and do it. You're going to learn more from that. And each time you're going to learn a little bit more that's going to make you better the next time. And so that's really the theme for me in business. It's the same way. I've had my highs and lows like any other business. That's just the nature of business. You're not going to always be riding high and making millions of dollars.
Right.
Or at the end of the year, for my company, we've been around for over a decade. Our revenues each year are a few $1,000,000. But my expenses are not too far below that. People joke with me, you really should be a nonprofit. I said, at the end of the day, I don't care. I really don't, as long as people are being taken care of and we're succeeding as a group, and that other people are benefiting from what we do. So that's kind of my heartstream around my experiences of, as an independent business person. And what I would encourage with other people, don't get stuck in the mold. Don't get stuck in what other people think you should do or how you should do it. And don't ever be embarrassed because you took a risk and it didn't work out. You took something valuable from that opportunity or that experience, and you're going to take it forward into the next time, and you're going to do better the next time. And you're just going to learn from that and from the people who are with you who make mistakes. So, just go for it. Is what I have to tell you, and you'll get there, and you'll always feel good about it. And I do today. And financially, we've succeeded well. My wife and I just bought a house in Italy that's going to be our retirement villa. You take each step at a time.
Right.
Don't worry about the long-term picture. It'll happen on its own, but just do the right things along the way, and the journey. You'll always look back and have good memories, bad memories, but most importantly, you'll have known you did what was good for you and that what you had passion for.
I know when in our pre-conversation before we started the formal interview, you were saying that, having been invited to do this interview and getting some idea of the kinds of things we would be talking about, you did some reflection. And I've been asking you about a career that spanned a certain amount of time, your undergraduate degree, your master's degree, and so on. And I'm just wondering, as you reflected over those years, is there any one thing that, you could look at and say, wow, in my wildest dreams, I never thought I would have been doing this, or I would never have predicted that I would have done this thing or gotten to this point?
Mhm. Yeah, it's evolved, is
Mhm.
what I would say about that. There's a lot of people who have a lot of political views in life, and prejudices, for lack of a better term, that affect everything they do. And I learned a long time ago that I should close my eyes often and listen and not talk. And that's actually had a lot of impact on me. So today, I personally decide, what programs and projects I want to work on, regardless of what the rest of the world is thinking or doing. Today, for the last year, I actually did a year of free pro bono consulting for an organization in Western Massachusetts who serves primarily the transgender population. And they're a very disenfranchised group. They have very high healthcare needs. They have very high risk for sexually transmitted diseases like HIV and hepatitis C and those sorts of issues. And I spent a year, and more than anything during that year, than just working with the government trying to get a grant for these people, I became part of their family, and they're very exclusive in those relationships. And now I'm not a consultant, I'm their family. We worked together and met with state representatives, the governor's office, the state US senators, the Department of Health commissioner, and we were able to buy into them understanding the value of the programs, basically a whole different healthcare model that we were building, and to give us a grant that gave us access to a federal drug discount program so that these people get their drugs, like I said earlier, regardless of their income, their ability. Some people don't want to be insured because they don't want the rest of the world to know their business.
Right.
And that's children, that's adults. It's not their business in many ways. And because of it, they're willing to try to earn the money they can to take care of themselves, and we're able to close the gap and close that space so that they can focus on the higher priorities in life for themselves. So I've been doing it. I love it. It's something I have passion for. I'm just waiting for the next thing to come along that will excite me this much. But if this is the last thing I do in my career, I'll feel pretty good about it.
What a perfect note on which to end this interview. We're so very close to the end of our 30 minutes, and that time has just gone by. I am proud that you are an alum of our college and that you're out there in the field and you are serving your community so very well. And you are, an example of what our students can do and how they can use the education that they've gained through our college or departments and this university to really have a positive impact on communities around us. So thank you so very much for joining us.
My pleasure. Thank you for the opportunity. I really enjoyed today's experience.
Today, we've been speaking with Scott Ponaman, a graduate of our health administration program. He has had an amazing journey from student to professional. We are so grateful that you have shared your story with us and our students. I know it will inspire them to keep going and to do something similar or something different in their own career journey. So thank you, Scott, so much for your time.
My pleasure.